I'm Dr. P.C. Jagadeesh, Chief Orthopedic Surgeon and Director of Robotic Surgery, Bandarghatta Road, Asra Hospitals. The total knee replacement with the robotic surgery is done by surgeon, but the assistance will be given from the robo. Here, whatever the bone which has to be removed will be fed to the robo. The robo will decide what is the amount of the bone which we have to cut. In that way, it helps in deciding. But most of the work will be done by us who thinks and feed the robo. So the robo, after feeding it, it has got an arm. That arm we uses cutting the bone. This helps in taking a clear cut. So there won't be any irregular and alignment which we have decided that will be properly maintained.